Before we begin, I would like to remind everyone of the following information. PropelX is a funding platform, not a broker-dealer. A syndicate, if formed, will be managed by Plank Fund Management Corporation, a Nevada-registered venture capital firm. Private investments are highly illiquid and risky and are not suitable for all investors. Past performance is not indicative of future results. You should speak with your financial advisor, accountant, and/or attorney when evaluating private offerings. Neither PropelX nor Plank Fund Management nor any of its affiliates makes any recommendations or provides advice about investments. The information you hear today may make forward-looking statements about investments which have not been reviewed by PropelX or Plank Fund Management Corporation. You should not rely on these statements, but should carefully evaluate the offering materials in assessing any private investment opportunity, including a complete set of risk factors. Fantastic. Well, with that, I would like us to get started. And for those that are new, I'm just going to give a quick tour of the platform so you know what steps to take after. And then once we're through with that, I'm just going to hand over to Christin to take over. But for now, let me just share my screen. Just a quick, how do I, there we go. So here we are. This is PropelX platform. You all know how to log in. And once you log in, you go to invest in startups. There we are. Neuroage Therapeutics is right on top. They are raising a small, Christin is from the MIT alumni connection. They're raising their pre-seed round. You can review all of the materials about the company, including their pitch deck, which is right here. A little bit of materials about the company, their profile, who is on the team, any documents that you want to review. There's a number of videos that we've uploaded there, which you can review. And this webinar will be recorded and will appear right here once this is completed. Here are the deal terms, and if this is of interest to you, you can go ahead and pledge interest, which will look like this. You put in your amount, you click syndicate, and then you follow instructions to sign documents, etc. So it's a simple standard process. I think most of you are aware of this. I think with that, I am going to stop sharing. We are here to answer any questions if you have any. I'm going to stop sharing, and I'm going to hand over the controls now to Christin, who's going to walk us through Neuroage. And of course, as usual, if you have questions, please put them at the bottom of the screen. There is a Q&A bar there. I will moderate the questions as we go along. Thank you. Thank you for joining. And Christin, over to you.
Great. Thank you so much, Swati. Appreciate it. So we're Neuroage Therapeutics. We are a company that's aimed at reversing brain aging in order to prevent dementia. I'm Christin. I'm a physician, neuroscientist, and serial entrepreneur. And the company is based on the last 20 years of my research out of MIT and before that at CMU. So in a nutshell, we think of ourselves a lot like Tesla. So Tesla is selling cars in order to gather the data that they need for better self-driving. We're selling the Neuroage test for brain aging in order to gather better data and generate early revenue for Alzheimer's biomarkers and therapeutics. And before I tell you how we're doing that, I'd like to tell you a little bit about why I started the company. These are my grandparents, and at the end of her life, my grandmother suffered with Alzheimer's disease, and my grandfather took care of her in the home. This had a really big impact on me as a child, led me to dedicate my life to coming up with better solutions for Alzheimer's disease. Now, unfortunately, it's in the next generation, and her daughter, my aunt, is late stage with Alzheimer's. And I myself found out that I have a genetic risk factor for Alzheimer's disease that puts me at higher risk in my 70s and 80s. So I have a deep personal investment in trying to come up with ways that people can prevent having Alzheimer's in the future. This is a very common story. Nearly 9% of the world has some form of age-related neurodegenerative condition. And as we get better at treating other diseases like Alzheimer's like heart disease and cancer, more and more people are going to be suffering from Alzheimer's disease at the end of their life. So what my previous research out of MIT showed is that if you can be 5 years younger in your brain aging, you're actually 6 times less likely to have Alzheimer's in the future. So we created a test that can measure aging in the brain and followed older adults longitudinally at the end of their lives, and they agreed to donate their brains for science. And then we took those brains and we showed that people that were 5 years younger, so their brains looked 80 when they're 85, were less likely to have Alzheimer's. It happens later in life. They were less likely to have pre-Parkinson's signs, and they had better memories and mood overall. And so what this told us is that if we can help people track their brain aging and reverse their changes, that's a really viable strategy for keeping people sharp throughout their lives. And if you want to read more about this, you can do so in our publication. So you go to the doctor every year, you get preventative screening for other diseases. So you get your cholesterol checked for heart disease, you get your glucose checked for diabetes, but no one's checking your brain aging for future risk of neurodegeneration. Until now. So we've created the Neuroage test for brain aging. It's a first to market test. It's super comprehensive. It combines blood biomarkers plus brain MRI plus cognitive testing online using our software. We put this together into a super predictor using AI. It's already been trained on more than 500,000 people and is continuously learning. And we can give people a brain aging score. So this is Max. Max is 55. He has a neuroage of 51. He's 41% less likely to have dementia in the future than the average person his same chronological age. Now, no one would want this information unless there's something they can do about it. So about 40% of your rate of brain aging is due to lifestyle. So we give people ultra-personalized lifestyle and health recommendations based on their biomarkers and the rest of their testing. They can implement those, come back, get retested, show that they've reversed their brain aging further. And then if lifestyle alone isn't enough to prevent them from developing an age-related neuro disorder in the future, they're contributing in a privacy-protected way to FDA-approved therapeutics that will be waiting for them if lifestyle alone isn't enough. We have a sleek client dashboard. So I just want to walk you through what our product looks like. So this is a demo dashboard. You're welcome to go to demo.neuroage and check it out for yourself. So this person is a 54-year-old gentleman, and he has a neuroage of 51. And that's a combination of the cognitive testing online, plus the blood biomarkers, plus the brain MRI. And then separately, we give a genetic resilience score. And the less resilient you are genetically, the more you need to worry about the lifestyle piece. So the genetic score is comprehensive testing. We send saliva kits to people's houses so they can do it from the comfort of their own home. We test for more than 41 different genes. 23andMe was only testing for one, so it's a very comprehensive look at your genetic risk. And then your genes actually factor into the personalized recommendations that we're able to give. Then going through each of these pieces on its own. So the cognitive testing portion using neurogames takes about 30 minutes to complete. You can just play these games online. They're games of reaction time. How many names can you remember with faces, which a lot of people are concerned that maybe they're forgetting more names and faces than they used to. And we combine those results into a single score based on all of their gaming results. We also break it down into comparing each game versus the average score for all users and the average score for users of your age and sex. Secondly, the blood biomarkers kit is at-home blood testing. So we send kits in the mail and people can mail them back. It's painless. Takes about 1 ml of blood in the arm. And then we give people a blood biomarker score. This is proprietary to Neuroage. We're the only company that have these biomarkers. It's 52 RNA levels of genes that track your brain aging directly from your blood. And then the last piece is brain MRI. So we're partnered with more than 300 MRI clinics in 7 countries. We send people locally to get a brain MRI. It's preventative screening, so we rule out tumor, strokes, and aneurysms. We also see things like mild white matter hyperintensities. These are quite common with age. They're little cardiovascular problems with the blood vessels in your brain. They aren't benign, so they put you at higher risk for Alzheimer's and stroke and vascular dementia. But the good news is that they're partially reversible. So when we see this, we recommend people have better cardiovascular control. They can get retested and show that they've decreased their white matter hyperintensities. Lastly, the brain actually shrinks with age. So this is the average of brains from 18 to 30-year-olds to 61 to 70-year-olds. And you can see a subtle but steady decrease in the overall size of the brain. That's due to loss of neurons and loss of the connections between neurons. Some people's brains shrink a lot with age and some shrink hardly at all. It's a really good indicator of how people are doing with their health. And I think one of the coolest parts of the project is we actually give people a personalized dashboard that shows them their brain. So this is my brain. And at the time of the scan, I was 42. So I was testing 3 years younger by volume. This was reassuring to me given my family history. I'd like this number to be 5 years younger because that's the magic number to avoid Alzheimer's in the future. You can also look at each region of your brain, which does a different function. In particular, this is the Alzheimer's region. So this is my hippocampus, which I'm reassured to know that I'm in the typical volume in terms of the size of this Alzheimer's region. It means I haven't lost neurons and I'm not at high risk currently. We give a super comprehensive report based on your results. They go through each brain area and what it means. And then we have personalized lifestyle and health recommendations at the end that are tailored to people's results. So that's a little bit about our product. We offer tiered pricing. So our starter package is $15.98. That's out-of-pocket payer. We're both direct to consumer and also selling through clinics. And that has all of our core features of our product. People can also choose a la carte pricing. So some people only want the cognitive testing, for instance, for $99 a year. We're currently being sold in private payer clinics around the world, as well as directly to consumer in 7 countries. We launched about 5 months ago and are at 180K ARR run rate. We don't need FDA approval, but we are seeking it because that will broaden our customer base through reimbursement. We have investment from the Alzheimer's Drug Discovery Foundation and Gates Ventures. We're about halfway through our clinical study. Part of the reason we're so successful in partnering with these clinics is that there really isn't another product on the market that's quite as personalized and comprehensive as ours. Our closest competitor is probably Apollo Health, which is Dale Bredesen's company. But they're not doing the personalized prevention recommendations and the genetics and a lot of the pieces that we're doing. It's also really geared towards people that already have Alzheimer's disease as opposed to people that are trying to prevent it. And then there are other companies that are doing pieces of what we're doing, whole body scans, genetic testing, cognitive testing. And then, of course, traditional medicine is reactive rather than proactive. So they really wait till you have a disease diagnosis to do anything about preventing Alzheimer's. Our customers really are loving us and promoting us. So we've been on podcasts with 2 different physicians and clinics after partnering with us. We're also, one of our customers, our first beta testers, wrote a whole post on Medium about us and promoting what a great time he had with our products. The Neuroage test itself has about a $2 billion market. That's the size of the cholesterol testing market, roughly. And it supports the more than $25 billion Alzheimer's therapeutics market. We are projecting 5-year revenues ramping to 100 million with potential exits along the way to big pharma and big health tech. And that's from sales of the test itself, but also sales of the data. So the data set we're collecting in a privacy protected way is super valuable for health and pharma companies for drug discovery and clinical trials. In terms of our IP strategy, our AI algorithms are proprietary, as is our blood biomarkers test. We have trademarks on our software as well as our name. Our data is invaluable, one-of-a-kind data set, longitudinal, multimodal, multi-omic, which provides a moat. And we will have future composition of matter patents as well. We're an expert team with more than 55 years of experience. I was previously head of AI of a Stanford spinout. I'm also a serial entrepreneur, so I run a well-known longevity nonprofit community, which also helps us advertise for Neuroage. I'm well-known in this space. Sam I've known for 7 years. He has a computer science degree from MIT and helps us with algorithms. We also have a full stack engineering team, as well as 3 different business development folks that are experienced helping us make partnerships. We have an expert advisory board with multiple exits in the AI space, Stanford and CMU professors, key opinion leaders, and people with deep pharma expertise. Ranjan in particular is an investor in the company, as well as a advisor we work closely with. We're founded in 2022 and have so far raised 1.3 million. That's an angel venture and accelerator funding. We went through Berkeley. We're alums of Berkeley Skydeck, which is UC Berkeley's accelerator program. We also have our lab space at NBC Biolabs in San Francisco that's been sponsored by the pharma company AbbVie, and are winners of the Stanford Longevity Company Competition, as well as the National Institute on Aging Startup Challenge. We're raising up to 1 million on a safe at an $8 million cap, post money and a 20% discount. This is a standard YC safe. That's to get to 2 million ARR in the next 18 months. We really need to hire more clinical administrators so that we can focus on marketing ourselves, take something off our plate. We have a lot of customers that we need admin help to schedule. We also want to take our web app and turn it into a mobile app. We think that this will drive a lot of sales. We also could use hiring a few more people, including some engineers. And with that, I'm happy to take any questions. You can also play the Neuro games for free. There's a QR code there. It'll tell you your reaction time versus the average person and names and faces as well.
Thank you so much, Christin. Fantastic. Very much on time. So we can use the rest of this time for Q&A. There is a question there. Any insights on what consumer segment or what types of organizations will likely be your clients?
Yeah, so what we're seeing, it's a younger clientele than you might expect. So our average client is in their 40s or 50s. And a lot of those folks either have had a family member, a parent or a grandparent or aunt or uncle that has suffered with dementia, and so it's top of mind for them. Or they're, just very interested in biohacking and knowing their own health. So they want all of the testing as part of being early adopters in the health tech space. So those are the two sort of archetypes of people that we're seeing currently.
Thank you. I think another question that is related here is it's $1,600, it's out of pocket, the test. What is you mentioned some of the demographics, but I want you to help us understand how people are able to pay for it. I mean, these have to be wealthy people, right?
Yeah, so currently they're definitely a wealthier demographic. So it's the same demographic as people that are paying for full body MRIs with Prenuvo and Ezra and some of this other testing. We're also partnered with longevity clinics. So these are folks that are already spending a lot of money on healthcare out of pocket.
What
Um,
is longevity clinic?
so this is private pay clinics from physicians that are sort of on the cutting edge of medicine and are helping people with preventative health care to instead of waiting till they're sick to try to prevent illnesses before they happen. And
Yeah.
so they're using, cutting edge, brand new technology like whole body MRIs and the Grail cancer blood test and, heart CTs to give people a really comprehensive picture so they can prevent things at their earliest stages before they become big problems.
So in other words, there are already these rich people who are spending a lot of money on reducing their neuroage, I suppose, and those are primary targets for you.
In phase one. So we do think of ourselves, like Tesla rolled out a very expensive car to begin with. It's become more and more affordable over time. That's going to be true for us as well. The cost of all of this testing is coming down rapidly. Just the genetics testing used to be $30,000 per genetic test 10, 15 years ago. It's now less than $300. So those prices are going to continue to come down, and I think this is going to be very affordable in the future. We're also part of our test is going to be insurance reimbursable, the brain MRI part already. There's CPT codes for reimbursement currently, which will make it more affordable for people. And then lastly, once we seek approval, we envision this to eventually be just a blood test, like a cholesterol test that's approved by the FDA and is given yearly as part of your regular doctor's exam, and then it'll be available to everyone.
Yeah. So, Kristen, when we had earlier spoken, we had discussed how valuable your data is going to be or not. So, could you please expand on that, just because I feel we didn't touch on that today enough. So, if you could talk about any precedents that exist and how long till we get there? How much data do you need? And at the rate at which you're gathering it today, how long till we get there?
Yeah, so to put this in perspective, 23andMe, which has just a tiny fraction of the data we have, so they have not even a complete genome, they just have one hundredth of your genome plus some health records. They sold their data set for more than $300 million. And actually, even though that they were in trouble and have gotten a lot of bad press lately, they were bought by Regeneron recently for that super valuable data. Our data has not just genetics, which is 100 times the genetic information. It also has brain MRI. It also has cognitive testing. It also has blood biomarkers that are multi-omic, and it's longitudinal. This data set is, 100 times more valuable than the 23andMe data set. So we imagine that that's really the true value proposition of our company, is this beautiful data set that big pharma is going to be very interested in for a number of different reasons, not just neuro, it's also valuable for other diseases. It's valuable for clinical trial segmentation. It's valuable for recruiting.
Yeah. And how many patients do you need data for before it becomes actually valuable to these folks?
Yeah, so we're estimating around 10,000 patients would be super valuable, and we can definitely easily get there in the next 5 years.
5 years. So 10,000 patients in 5 years. Okay. A few more questions. Do you have a data room that you can share? We can make it available.
Yes, absolutely.
Okay. Are the packages, question here, next question, are the packages sold on a subscription basis that auto renews? And can changes be made year to year? How often do you recommend that the MRI be repeated?
Yes, so it is a yearly subscription, and we stay in touch with folks during that time to keep them engaged. We offer continuous new genetic insights and new personalized health insights. And we recommend that people repeat the MRI yearly. It doesn't have contrast or radiation, so it's safe to repeat as much as people want, really, but yearly seems reasonable.
Is there much difference within a year?
There are studies that show that you can actually decrease your brain aging in 6 months, maybe even less time than that.
All right.
That's what the studies have shown.
Got it. Thank you. I actually had one of the questions on your follow-up. So you said that based on the brain age, you're able to suggest certain lifestyle changes, nutrition changes, and so on. And my question was, do you check patients after they've adopted those changes, or is it just, and have you seen a change in brain age based on that?
There have been studies that have shown with just 25 extra minutes of exercise a year or a week, I'm sorry, that people were able to increase their gray matter volume on MRI. So people are literally growing their brains back. So we have seen that as well.
Like physical exercise grows the brain?
Yes. Yeah.
Okay, good to know. I shall increase it by 25 minutes starting today. Okay, all right, that's helpful. How do you ensure data privacy? What insurance do you have in place to protect the company in case there is a data leak?
Yeah, so we're fully insured and certified. We are storing our data on Google Cloud, which is privacy protected. All of our data is anonymized, so we're the only all of our partners don't have access to people's information. It's all de-identified in the way that we process it.
Sorry. Apologies. Oh, all my devices are ringing at once. Okay. Sorry, I apologize. So I did have a follow-up question. Oh yeah. So about your revenues, you mentioned 100 million in revenue. I mean, that's a number out of thin air. I will concede that. But how do you, so it's $1,600 per patient. And then what is the stickiness, right? So every year, how do you see that? What percentage of that is going to be data sales versus actual patient tests, right? And what is the repeat investor rate, or how do you measure
Yeah.
that?
So we see this as a tiered program. So in the first 3 or 4 years, it's going to be direct sales of the product. It is very sticky. So we're seeing, 40% of our customers continue to interact with the product even after they've
Okay.
completed testing. So they're coming back, they're repeating neuro games. A lot of people are trying to do better on that cognitive testing, which is fun. We encourage that. They're trying, lifestyle changes, coming back, seeing if they can improve their reaction time. So we do think that that's a pretty good sign in terms of stickiness of the product. And then in years 4 and 5, that's when we're going to begin the big partnerships with pharma companies for data sales and collaboration surrounding clinical trials and drug discovery.
Good. Seems to me that you might get there, the 100 million just on sales of the test itself.
Possible, yes.
Okay. All right. Here's another question. How many patients are now in that ARR that you described? So you said 180K ARR. Help us understand what that means. I know we've discussed this before.
Yeah, so it's about 20K in revenue per month. So that's run rate for the year so far. We are ramping that up over time. And we have about 1,300 clients on our platform currently.
So currently 1,300 clients, and all 1,300 came since you launched in January, of course. You launched it in December.
December, yeah.
So it's rapidly growing. Okay, very good. What's the difference between the $1,600 package you mentioned and the $3,200, $3,194 package on the website? It looks like just the MRI portion is about $1,600.
Correct. So the 3200 includes the whole genome sequencing and the blood biomarkers. So our starter package includes just the analysis for those, as well as the neuro game. So we're changing the pricing currently. We think that having an essentials package and then allowing people to add on is going to be a better price point for our customers based on some A/B testing with pricing.
So, Kristen, do you have any comparables for exits? Like what kind of valuations do you like? Do you know how much Regeneron acquired 123andMe for?
I don't know that number. Yeah, I'd have to look that up. That was pretty recent. But you know, I would imagine that, if what we're projecting would be at least a $300 million exit, something like that.
That's just based on your data, because that was what
Yeah.
was bought by Lilly, was it? Lilly bought data from
I don't know.
GlaxoSmithKline. It was GSK, I think.
Yeah.
All right. Very good. This is super helpful. Please just keep the questions coming. Any comments on the recent findings that the shingles vaccine decreases likelihood of Alzheimer's? In fact, there's a lot of, so please comment on that. And then there's a lot going on in the Alzheimer's space. It's not just this vaccine, but there's a bunch of other things. But please comment on that, and then we can talk about others.
Yeah, so I think that was a really exciting study. It was real world data out of the UK that showed that people who were around 70 who got the shingles vaccine, they were then followed, were 20% less likely to have dementia in the future than people that did not get the shingles vaccine. And we think that's because of inflammation. So shingles is a reactivation of the chickenpox virus when you get older, and it causes inflammation, and that can lead to brain degeneration. So being vaccinated for shingles, I think, is a really good idea for anyone over 50. There's other viruses that also, can result in degeneration as well. So being up to date with all of your vaccinations, I think, is a really good idea.
Okay. I don't have very many other questions. People, if you have questions, it's all gentlemen, sad to see. But anyway, if they have questions, please, if you all have questions, please let us know what your questions are, so Kristen can answer those. And one last question about your IP. So you mentioned a future composition of matter patents. What does that? What are the implications of that? Firstly, why would it be composition and not, I mean, you just have data and software and so on, right? What are your patents around?
Yeah, so currently our IP is around our AI algorithms, as well as our trademarks and copyrights, and our proprietary blood test. So there's methods patents surrounding blood testing. So we're going to have those in the future. There's also composition of matter is more to do with joint collaborations in drug discovery in the future. So if the company long-term will be collaborating with big partners like Eli Lilly and others who are already kind of in those conversations about how drug targets we identify with all this beautiful longitudinal data using AI will be really valuable to work with big partners on. So that's composition of matter is around those.
And have you had any of those conversations, at least the start of them?
We have, yes.
And are you able to share who with and what those conversations were?
So they're large pharma partners. We are under NDA. So I can't give too many details on that, but it is about jointly developing drugs for Alzheimer's.
And how far along are these conversations?
We're under NDA. They've written us letters of recommendation for grants. So we're pretty heads down on, trying to build the business, and but we are spending a small percentage of our time pursuing this with these pharma partners. So it's early days.
Okay, so they've just recommended that the government fund your research. Is that still happening?
I'm sorry?
Is that still happening? Are the grants still being, still being given out?
So the grant funding situation is a little bit dire in the US. So we're now applying for foundation funding. So we have funding through Alzheimer's Drug Discovery Foundation already, and there are additional foundations that we're applying for funding through. So because we're trying to be pretty focused, we're not spending a whole lot of our time on the drug discovery side, although we are very interested in it.
Okay.
Yeah.
There's a question by one of our investors. Was there any client showing concerns about their data being sold? Are they all aware of how the data is processed and sold afterwards? This is a very important question, I guess. Thank you so much, Ellen, given what went on with 123andMe.
Yeah, of course. And that was a huge issue. 23andMe had a data breach, which resulted in leaking of people's data. It's my understanding that that was due to the way that data leaked was internal people clicking on phishing links. So we've talked to a number of different consultants about data privacy and have done all the best practices in terms of protecting data, but that's really informing employees not to click phishing links. We still haven't gotten around that, I guess, in the broader world of what to do about that. But everyone is very informed. We have a terms and conditions sheet that everyone signs that signs up for Neuroage. That explains what we do with people's data. We don't sell any data that's not been de-identified, so nobody's names are attached to any of the data sales we make, but we do plan to sell the data for what I think is a really good cause, which is better therapeutics for neuro disorders.
Great, thank you. Anything else from anyone else? And just the terms of your, just as a reminder for our investors, terms of your note, I think it's a YC safe post money of 8 million. Yeah, 20% discount. How much of that is filled?
175K has been allocated already.
Okay, so we have quite a bit left. 825K is left. So we have an opportunity, I suppose. That's fantastic. Well, thank you so much, Christin, and thank you everybody for being here today. Of course, if you have more questions, we're happy to communicate them. You can also ask them directly through the platform. There's that button, ask a question. Please do use that. Thank you so much for being here, and the recording will be available online. Thank you, everyone. Bye-bye.
Thank you. Thanks for the time.